purpose of this information session is to explain some important information regarding warfarin and to help you to understand how it's used in the management of your condition. This session does not replace talking to your doctor or pharmacist. The top 5 things to remember about warfarin are: take warfarin at the same time every day. Go for your blood tests as instructed. Tell your doctor, pharmacist and blood testing laboratory if there are any changes to your medicines or if you're ill. Maintain consistency in your diet. See your doctor if there are any serious signs of bleeding. These points will be covered in more detail. Warfarin belongs to a group of medicines called anticoagulants and is used to slow the clotting of blood and prevent formation of unwanted blood clots. You may also hear warfarin described as a blood thinner. It can be prescribed for a number of conditions including, but not limited to, atrial fibrillation or AF, which is an irregular heartbeat that can cause clots to form in one of the heart chambers, which may then dislodge and travel to other parts of the body, including the brain, causing a stroke. Deep vein thrombosis or DVT, a clot in the leg. Pulmonary embolism or PE, a clot in the lung. And heart valve replacement, where a clot may form over the replacement valve and then dislodge and travel to other parts of the body. These conditions involving formation of blood clots can be very dangerous, and warfarin treatment is essential for many people with these conditions. For example, if you have AF or irregular heartbeat, taking warfarin will reduce your risk of having a stroke by 2/3. If you don't have one of these conditions and are not sure why you're taking warfarin, please ask your doctor. Normally when you cut yourself, you damage blood vessels in the skin, causing blood to leak out. That is, you bleed. When this happens, the body responds by causing the blood to clot or stick together, which seals off the wound to prevent more blood being lost. If this clotting occurs inside blood vessels where there is no wound to seal, things can go wrong. If a clot were to form within a blood vessel, it's possible it might break off, travel and become stuck in the lungs, a pulmonary embolism, or heart causing a heart attack, or brain causing a stroke. When this occurs, it's a medical emergency and must be treated immediately. Warfarin works to prevent formation of such clots. The normal blood clotting process in the body is quite complicated. For blood to clot, several clotting factors are needed, some of which rely on the presence of vitamin K to work. Warfarin blocks the actions of vitamin K, and so also blocks the actions of some of these clotting factors. The clotting process is slowed and the chance of unwanted clot formation is reduced. Warfarin tablets are available in 2 different brands, Coumadin and Maravan. Once you've started on one brand, you should keep taking the same brand unless told otherwise by your doctor. The brand you'll receive if you commence warfarin in Queensland Health hospitals is Maravan. Maravan is available in 1 mg, 3 mg and 5 mg tablets. The bottles and tablets of each strength of Maravan are different colours to help distinguish them from each other. The 1 mg bottles and tablets are brown, the 3 mg are blue and the 5 mg are pink. Coumadin is available in 1 mg, 2 mg and 5 mg tablets. The bottles and tablets of each strength of Coumadin are also a different colour. When you're first prescribed warfarin, you may be given a supply of all 3 different strengths of tablets. You'll need to make up your dose with the tablet supplied. For example, if you were told to take 4 mg of Maravan, you would need to take 1 brown 1 mg tablet and 1 blue 3 mg tablet. If you were told to take 5 mg of Maravan, you would need to take a single pink 5 mg tablet. The tablets have a score mark down the centre, so they may be broken in half if required. Different people require different amounts of warfarin to prevent the formation of blood clots. Your doctor and blood testing laboratory will adjust your dose of warfarin to suit you. Your dose of warfarin may change over the course of your treatment, depending on your blood test results. By getting into a regular, daily routine for taking your warfarin, it's less likely that you'll forget and miss a dose. It's usually easiest to take your warfarin dose in the evening. This will fit in well with your regular blood tests. If you forget your dose, but remember within 2 to 3 hours, you can safely take it. If you forget for longer than this time, then do not take the forgotten dose, but take your normal dose when it's next due, and tell your doctor or the laboratory that looks after your blood tests. It doesn't matter if you take warfarin with or without food. However, you should stay consistent, either always taking it with food or always without. Never take a double dose. In order to make sure that warfarin is working how it should be, you'll need to get regular blood tests. These blood tests measure your INR, which is a measure of how slowly your blood clots compared to a person not taking warfarin. When you first start on warfarin, you'll need more frequent blood tests and your dose may change in response to these. Once your INR stabilises, you'll not need blood tests as frequently and your dose will become more consistent. Important things to remember about blood tests are: make sure you have the INR blood test every time the doctor orders it. Call your doctor or laboratory within 24 hours of your test to check what dose of warfarin to take until your next blood test. Record your INR result and warfarin doses in the record sheet provided. A person not taking warfarin would be expected to have an INR of 1. When you take warfarin, your INR will become higher. Most people on warfarin need to have their INR between 2 and 3. However, some people will have a different range. Check with your doctor to find out what your INR range should be. If your INR falls outside your specified range, your doctor or blood testing laboratory will advise you if your warfarin dose needs adjusting. If your warfarin dose changes, your INR will also change. However, this may take several days to occur. Do not stop taking or change the dose of your warfarin unless the doctor or laboratory tell you to. Before you leave hospital, make sure you know when your first blood test is and what dose of warfarin to take until then. Lots of things can interact with warfarin and affect how the warfarin is working in your body. This can result in a change in your INR. Some of these things include changes in your diet, other medicines you're taking, the amount of alcohol you drink, and new illness. When taking warfarin, consistency is the key. Your warfarin dose is tailored to you and your current lifestyle. If you experience any changes in these areas, it's important to let your doctor know. When you're taking warfarin, it's important to maintain a well-balanced and consistent diet. You should avoid crash dieting or binge eating. If your dietary patterns change for any reason, including illness, tell your local doctor. Because warfarin works by blocking the actions of vitamin K, having a high amount of vitamin K in your diet can affect your response to warfarin and cause your INR to change. There are a number of foods that are particularly high in vitamin K. These include green vegetables like spinach, broccoli and cabbage. You'll be provided with a leaflet that will outline which foods are high in vitamin K. You don't need to avoid these foods completely, but ensure that you eat them in moderation and that your intake is consistent. Your doctor and pharmacist in the hospital will make sure that the other medicines you're currently taking are okay to take with warfarin. There are a large number of other medicines, vitamins and herbal supplements that can interact with warfarin. Always inform your doctor, pharmacist, dentist and anyone else that's treating you that you're taking warfarin, especially before taking any new medicines, vitamins or herbal supplements. This includes things you might buy over the counter at the pharmacy or in a supermarket, such as headache, cold or stomach medicines. Tell your doctor, pharmacist or blood testing laboratory if you start on any new medicines or if you adjust the dose of any of your usual medicines. These changes may affect your warfarin. Examples of common medicines that can interfere with warfarin include some antibiotics, medicines that are used to stop inflammation. It's particularly important to avoid ibuprofen, Warfarin and similar medicines, unless otherwise advised by your doctor, and some herbal medicines such as garlic capsules or St. John's wort. This is not a complete list of medicines that can interfere with warfarin. Your doctor or pharmacist will be able to help you choose a medicine that doesn't interfere with warfarin. Excessive use of alcohol can also interfere with the way that warfarin works in the body. Because of this, binge drinking should be avoided. However, a glass of wine with dinner is okay. If you have concerns about the use of alcohol while taking warfarin, you should discuss this with your doctor. Finally, if you are ill, for example with the flu, your INR may be affected. You should see your doctor, particularly if you're vomiting or have diarrhea, as your warfarin dose may need to be changed. How long you have to take warfarin for depends on what you're using it for and will vary depending on your individual circumstances. It's best to speak to your doctor regarding the duration of your treatment. Like all medicines, there are some side effects that you may experience while taking warfarin. The most important of these is bleeding. Regular blood tests to monitor your INR are important for this reason. By keeping your INR within your target range, it's less likely you'll experience bleeding. There are certain things that you should look out for when taking warfarin. Watch out for cuts or nicks that take longer than usual to stop bleeding, bruising more easily than usual, or having heavier bleeding during periods. More serious signs of bleeding are dark red or brown urine, dark or black bowel motions, and nosebleeds when you don't usually experience these. These more serious signs of bleeding are rare while taking warfarin, which is why if you experience any of these, it's important that you see your local doctor within 24 hours. If you cannot see your local doctor in that time, go to your hospital emergency department for medical advice. Since warfarin may lead to excessive bleeding, it is often ceased prior to surgical procedures. However, you should only stop taking warfarin if your doctor advises you to. It may also be advisable to avoid contact sports while taking warfarin due to the risk of excessive bleeding if injured. Some people choose to take other measures to prevent injury, such as using non-slip bath mats, an electric razor rather than a disposable one, and a soft toothbrush. If you become pregnant or are planning a pregnancy, you should discuss medication options with your doctor. Warfarin has the potential to harm an unborn child and is therefore not generally used during pregnancy. You should consider purchasing a medic alert bracelet or wallet card that notifies people that you're taking warfarin. Remember, tell everyone treating you, including doctors, dentists, pharmacists and natural medicine practitioners, that you're taking warfarin. To recap, the top 5 things to remember about warfarin. Take warfarin at the same time every day. Go for your blood tests as instructed. Tell your doctor, pharmacist and blood testing laboratory if there are any changes to your medicines or if you're ill. Maintain consistency in your diet. See your doctor if there are any serious signs of bleeding. Warfarin is a very important medication for many people, and when used correctly is often tolerated well. If you would like more information, ask to speak to your pharmacist or doctor.